We have sent close to 8 million doses to South Africa, 13 million to Southern Africa, over 93 million to Africa, and 275 million to the world. This is not meant to be a criticism. It is meant to give people understanding of what the challenges are in a lot of countries, is that it's not just about having vaccine doses. It is about ensuring there's operational capacity, which is not meant to be a criticism of any leaders in government, but more it's challenging to have public health officials in all communities of any country available. And also there are hesitancy issues in not just the United States, but many parts of the world.
The Biden administration rebuked criticism that the U.S. is stockpiling vaccines at the very moment the government issued a travel ban on 8 African countries by noting that South Africa turned down additional vaccines from the U.S. But as the White House press secretary noted, South Africa's decision comes down to an issue of infrastructure and access. Vaccination efforts began in South Africa 6 months after they did in the U.S. and other wealthy countries. Though South Africa fared comparatively better than the rest of the continent, they're facing challenges that also afflict the U.S., such as getting doses to rural populations and combating vaccine hesitancy. Pfizer noted that 5 other countries singled out by the U.S. travel ban also asked the company to pause shipments due to capacity issues. On a continent of 1.2 billion people, the 54 nations in Africa all face their own unique challenges when it comes to getting the remaining 93% of the population vaccinated. Fragile healthcare systems, lack of transportation, and unpredictable deliveries all play a role. Many countries, including South Africa, went several months without receiving a single dose to receiving millions at once. South Africa has the infrastructure at hand to store Pfizer's doses, which need to be refrigerated at ultra-cold temperatures, but many other countries do not and fear they don't have enough time to safely administer the vaccines that are rapidly approaching their expiration dates. The White House said it's working with African experts and institutions to expand vaccine access on the continent. The press secretary also noted the U.S. is ready to provide South Africans with more doses whenever their government is ready to receive them. Joining me now to discuss is Dr. Matifadza Hlatshwayo Davis, Director of Health for the City of St. Louis. Dr. Davis, thank you so much for joining us. This issue of vaccines and getting them to poorer countries is far more complicated than people originally received it when they said that South Africa turned down vaccines. Talk to us about all the kind of hurdles that are involved in these countries, just literally receiving the vaccines, storing them, and then getting them out and into arms in time before they expire.
Thank you so much for having me and for highlighting how complex this issue actually is. So let's start with the fact that Africa is as a continent of 66 countries, a continent of 66 countries, the second largest continent on Earth. So to oversimplify the issues around supply, access, and lack of vaccine confidence is, to me, a scapegoat, right? So we know that there have been 5 African countries that have said, please, we can't deal with any more vaccine product right now. What leadership looks like is not to say, well, we did our part and they can't handle it. What leadership should look like in this moment is global vaccine equity is about more than just supply. The reason why a lot of these African countries have to do with a complex history of post-colonialism that has created valid mistrust that was made much worse by the fact that these African countries were left behind and only started to get a lot of the supply way after the rest of the world did as well. And that when we talk about supporting these countries, it should not just be about supply, but about increasing manufacturing hubs, ensuring access is available to folks on the ground, and also supporting these countries with funding for to deal with the lack of vaccine confidence that is multifaceted and very valid in many cases.
Yeah, talk to us about this because, it's fascinating to me. If you have a continent where 93% or so of the people are not vaccinated, that means that is an enormous pool of people, 1.2 billion people on the continent of Africa, enormous pool of people for the virus to keep infecting, keep mutating. You'll never get ahead of it. This cannot be looked at as some sort of welfare to poor countries. You can't send someone a vaccine that needs to be refrigerated and they don't have a refrigerator. Talk to us about how much needs to be invested very quickly from wealthy countries into the continent in order for them to make sure that they can ship vaccines and those vaccines will be able to be stored and then therefore delivered in order for us to get ahead of this virus.
I spoke to one of the ministers of health in Northern Africa who discussed with me that some of the shipments that come are from vaccines that have been in storage in high-income countries and that are about to expire. So what happens is they get sent all of these vaccines and they're about to expire within days. So not only do they have now a shortened window, but to be able to get these vaccines out, but this is already in countries where that infrastructure is lacking. And so again, I'm very, very, very disappointed in this scapegoat type politics that says, we sent X number of million, we did our part, they said they didn't want them. We all know that there's more to it than that, right? So what global vaccine equity should look like is a wrap-around approach and multifaceted approach to providing support. And again, while high-income countries should say, why is this on us? Well, that's part of the reason why we're still here 2 years later, is because whether or not we like it, this is a global pandemic. And a threat here is a threat there, but a threat there continues to be a threat here. And shutting down the borders to only 8 African countries, when today we have had report after report after report of new countries in Europe who have had this, who have detected this variant, not only now, but are now claiming that they had this variant detected even before. So the response then, after ignoring the multifaceted approach to global vaccine equity, is to say, and furthermore, we will impose travel bans only to African countries, not to any of the European countries that have been highlighted as having this variant. And so in a country that's already struggling, that already has issues around infrastructure, we're going to impose travel bans that we know have devastating economic impact. And today, and over the last 2 days, hearing from the same expert scientists, Dr. Sikulele Moyo, a Zimbabwean, Botswana-based scientist who did the superior genomic sequencing that even made this variant available to us, now in a country that has been banned. And so these same scientists that did all of this work cannot even get the reagents to further their work. This is absolutely unacceptable. I am supremely disappointed and devastated on behalf of my African brothers and sisters.
Dr. Matifadza Hlatshwayo Davis, thank you so much for joining us tonight. Very important conversation and insight.